Hey guys, welcome back. Today, let's talk about dark lips, what causes them, how to best care for your lips, and how to fade dark lips once it does occur. My name is Dr. Jenny Liu. I'm a board-certified dermatologist, and welcome back to my YouTube channel. So recently, I've been getting a lot of questions, especially on my social media, regarding how to best address dark body sites. For example, armpits, inner thighs, elbows, and knees. And one has been dark lips. You know, this is a topic that, like many other are nuanced. There are a lot of different causes, including some variation of normal if you are skin of color. And it's always hard for me to come on YouTube to give specific recommendations because it really needs appropriate assessment and treatment by a dermatologist. But here are things that I frequently see contribute to dark lips, and hopefully you will find this video and these tips helpful. So before we dive into the causes of lip hyperpigmentation and lip irritation, let's kind of talk about why our lips is a sensitive area that is prone to this irritation. First of all, the top layer of the skin in the lip, the stratum corneum, is a lot thinner on the lip than the rest of our body. That, along with less ceramide, means that our lips are 5 more times prone to transepidermal water loss and dryness compared to the rest of our face. There's also really no hair follicles or oil glands on the lip. Again, that leads to less protection and more prone to dryness and irritation. The turnover of the skin of the lips is higher, and that is mostly a protective mechanism. As you can imagine, we use our lips to eat and chew food, and there's a lot of trauma to that mucosal surface. So that high rate of turnover really helps to generate a new protective layer throughout the abuse, if you will, that we subject our mouth to when we eat and drink. So because of the high rates of turnover, the thinner skin, the lack of oil glands and hair follicles, this just means that our lip is more prone to dryness and less able to retain water, and thereby more prone to irritation and more sensitive than the rest of our face. So first and foremost, dark lips can be normal. Just so can be, dark armpits, dark inner thighs in individuals of color. Sometimes that can be made worse over time, especially if you are darker skin and there's minor subtle inflammation that adds up over time. It can certainly add to the appearance and the darkness of your lip. Certain lifestyle habits can do it too. Smoking, lip licking, that can lead to dry lips. Some of us are more prone to the habit of licking our lips. The saliva has digestive enzymes that can irritate the mucosal surface of the lip, and the constant wetting and then drying of the lip further pulls water from our lip, leads to more dryness and therefore breakdown of the mucosal surface of the lip, and therefore more dryness and irritation, as well as aggressively wiping your mouth with napkins or after eating. All of that irritation, especially if you're darker skin, can over time lead to small deposits of pigment and therefore gradually will add to the appearance of darker lips. Now, for the majority, dark lips often is from underlying irritation, therefore inflammation, and therefore post-inflammatory hyperpigmentation of the lip. And so this is where I want to inform you guys of the potential causes and how to really best take care of your lip to minimize that inflammation. And if you do have pre-existing hyperpigmentation, these tips hopefully will help more gently improve that darkness without overly irritating your lip and thereby further compounding and worsening the underlying situation. So let's talk about some of the medical causes of lip irritation and thereby contributing to the darkness. Number one is contact dermatitis, and this can be broken down to allergic versus irritant. And essentially the difference is that allergic means that there is an actual ingredient that you're allergic to. It's really hard to tell by just looking at your lip what you're allergic to. So really the testing is necessary to figure out the exact ingredient. How you would truly know is really by seeing a dermatologist and to undergo something called patch testing, which basically evaluates for products that come into contact with your skin. So for instance, things that you put on your lip that you may react to, and if there is a true positive reaction, then potentially that could be an underlying drive for the inflammation of your lip. And then with repeated inflammation, you can get buildup of pigment, especially if you are skin of color. I've seen cases where it can be as mild as just chronically chapped lips to lips that are really red and flaky and chapped and cracked. And so this is where if you do have an underlying, like almost like an eczema like rash of your lip that is just not resolving when when you're using Vaseline or removing additional products that you have been putting on your lip for some period of time, then see your dermatologist. Even certain types of toothpaste can do it, certain type of foods. I mean, certainly lip cosmetics and lip products are the most common cause. Another cause of dark lips, which is not truly the mucosal lip, but the upper cutaneous lip, and a lot of people call it the mustache sign, is melasma. Now, I am not going to go into detail about treatment for melasma because of a separate dedicated video that I encourage you to check out. But that can be another common cause of darkness around the lip area. Another medical condition, as I alluded to earlier, is called lip licorice dermatitis. And this is essentially just habitual licking of your lip. As I mentioned, the constant wetting of your lip leading to dryness, which often will propel us to lick our lips more. You just kind of get into this vicious cycle. But essentially, each repetitive wetting and drying cycle leads to further breakdown of the skin barrier, and therefore you can get a dermatitis as well as hyperpigmentation. And often in these situations, it's not just the lip, but often you will see the skin even on the lower or upper lip. That's naturally the mucosal lip that gets red and inflamed just because the saliva there is kind of transgressing onto those areas. Often we see this a lot in kids who are just in the habit of chronically licking their lips. In this situation, using a petrolatum ointment to really just help to protect the lip, to keep the lip hydrated and protected is really going to be key. When there is underlying inflammation, sometimes the over-the-counter cortisone can be helpful, and then is just helping to work with the individual on how to reduce that habit of chronic lip licking. Along the same lines, you can get another condition called angular cheilitis, which refers to irritation, chapped and cracked corners, the oral commissures, we call it, the corners of the lip. And often it's just really red and inflamed. It sometimes even hurts to open your mouth to chop or to eat. And what's happening here in certain individuals who are anatomically prone, whether it's, poorly fitted dentures, because we see this a lot in elderly patients, or just the anatomy of the face, what's happening here, they're more prone to saliva collecting at the corners of the mouth. And over time, the saliva is breaking down a skin barrier. There can also be additional growth of bacteria and yeast that causes inflammation, and then the skin starts to crack and becomes very painful. So those are some of the common medical causes of lip hyperpigmentation. I think the one thing I want you guys to take away is that when it comes to taking care of your lips, when your lips are inflamed and sensitive, is just use very bland and simple products. And really what I mean by that is just petrolatum. I mean, this is your best friend. Zinc oxide certainly can be helpful. Make sure to find one that is fragrance free. But for individuals who's looking for something extra or just don't like the thick goopiness of petrolatum, some other products I really like that have additional ingredients that may be beneficial includes Avène Cicaphate Plus. So this contains postbiotic ingredients, but what I really find to be helpful is that it's number one, pretty thick and pasty, contains copper and zinc for wound healing and helps to add additional protection to the lip skin. And this can be a really great one all over your lip. Another option I really like is from La Roche-Posay, the Cicaplast Balm. And that one is great because it's thick, it's hydrating, but it's not as goopy as petrolatum. And it also contains centella extracts. And centella is a great anti-inflammatory ingredient that also helps with healing. But again, I highly just recommend using petrolatum, or at the very least sealing everything in at the end of the day before you sleep with petrolatum, almost like slugging but for your lip. And so that way overnight as you sleep, you're not losing a lot of water and getting chapped overnight as you're sleeping. Now, I did not mention Aquaphor because Aquaphor has lanolin, and lanolin could potentially be a source of an allergen for some people with allergic contact dermatitis. Not all, but certainly not saying that you can't use Aquaphor, but for individuals that are sensitive to lanolin, you may want to avoid Aquaphor. So say you've had the underlying inflammation treated, it's gone, and now you're just dealing with hyperpigmentation. What can you do? So the most important thing, as I mentioned, besides protecting your lips with a petrolatum-based product, is going with a sunscreen on a regular basis, especially if you are someone who is really out and about, because we know sun exposure is one of the biggest drivers for persistent hyperpigmentation. So here I really love mineral-based lip chapsticks. For example, Ulta MD, Sun Balm, as well as Vanicream. All of those make great zinc oxide chapsticks. Granted, they may not be the most cosmetically elegant, but they are for sure going to protect your lips and they're going to be the safest, especially if you have lip sensitivity. There's also great options for lip color, and one I really like is from Color Science. And this is really nice, actually pretty color. It's got SPF 30, PA 4+, and this is purely zinc oxide. The next step is to properly cleanse your lips. So if you're someone who wear a lot of lip cosmetics and ones that are not going to be problematic, when you are removing makeup from your lip, really be mindful how you do so. So this is where I do not recommend any sort of physical exfoliation, scrubs, or even wiping of your lip, because that amount of repetitive friction over your lip can contribute to irritation, skin barrier breakdown, and further hyperpigmentation. You can just gently use a cleanser, ones that I frequently have talked about in the past from like CeraVe, Cetaphil, something that's really gentle, just kind of to massage over your lip to wash off any cosmetics that you may have applied on your lip throughout the day. Now, when it comes to using brightening or lightening ingredients, this is where you really kind of want to proceed with caution. There's really not a lot of products specifically made for lips, and I find that when you do use those things, it could be very irritating. So this is where I actually personally like fragrance-free brightening eye products for the lip, because the lip and the eyes are very similar. They're both very thin and delicate areas of skin on the face, and certainly products made for the eyes, in my mind, I find it to be very suitable for the lip area. I've shared my previous eye cream videos looking for ingredients that have vitamin C and niacinamide to help gently over time improve that hyperpigmentation is really going to be helpful. And I would further make sure the eye cream is fragrance free, just because not that I have anything with fragrance, but if you are prone to lip irritation, fragrance can just be a potential irritant that you just don't want to have in your routine. One I really like, I've mentioned this before, is from Drunk Elephant, their C-Tingle multivitamin eye cream. This is fragrance free. Another one I really like is the First Aid Beauty niacinamide eye cream. That is another one that helps to brighten and is also fragrance free. Another affordable option is from Olay, their brightening eye cream that's fragrance free. And so feel free to check out my other video for additional recommendations. But here, this is where applying an eye cream on a regular basis over time can help to gently even out some of that hyperpigmentation. Another tip you can try, as I mentioned earlier, no physical scrubs, but chemical exfoliants, when used correctly, can be helpful, not only removing the dead skin and dry chapped lips, but over time help to improve and fade dark lips. Again, proceed with caution. Consider starting off maybe once or twice a week, gradually increase as tolerated, but I don't think really your lip can handle any more than 3 times a week. And here I'm looking mostly at alpha hydroxy acid, so mainly glycolic acid, and to a degree lactic acid, that can be helpful in not only removing that dead skin buildup, but over time removing the excessive pigment that's developed from previous irritation. So a few products I really like. One is from CeraVe, the Skin Renewing Nightly Exfoliating Treatment. And this is one I've talked about before. It's a cream, but it contains a blend of 5% lactic and glycolic acid. It's fragrance free with ceramides as well as licorice root. So great ingredients here to help with the hyperpigmentation. If you prefer serums, there is that term lip basting, if you remember a while back, that was really popular. Basically, it's applying a liquid chemical exfoliant on your lip and then sealing that over with an emollient like petrolatum. And that can be a great way to help with dry, flaky lips. And then when you do it over time, most certainly help with fading dark lips. And one serum I really like that's fragrance free is from the Neutrogena line, their Skin Perfecting Serum. And they have different ones for oily skin, normal skin to dry skin. And I recommend starting off with the dry skin one, which is in a pink bottle. And that contains 7% alpha hydroxy acid as well as a little bit of polyhydroxy acid. So that will add a little bit of hydration along with hyaluronic acid to really help to keep your lips moist and hydrated. The other options I really like, the one from La Roche-Posay, the glycolic B5 serum, and this one contains tranexamic acid as well as vitamin B5 and 10% glycolic acid. This one I like because of the ingredients that help to work synergistically in fighting hyperpigmentation, and certainly I do like this more for the face than the lip, and I think for certain individuals it can be helpful. It does have denatured alcohol, which can be drying, but certainly if you're going to be using petrolatum afterward, then that shouldn't really be an issue. It's fragrance free. It is a little bit on the sticky side, so I find that it, for the lip, it just may feel a little awkward putting it on, but once you give it ample time to absorb, follow that with Vaseline or petrolatum, and this can be another great one. And if you're extra sensitive, then you can certainly even try like something like Biossance, their squalane and lactic acid serum. This is very gentle and it's fragrance free, something that you can eventually maybe work your way up to using more regularly on your lip to help to exfoliate and improve that hyperpigmentation over time. Alright guys, so that is my video on how to care for your lips and how to treat dark lips. If you have any questions, please comment below. I would love it if you can give this video a thumbs up and subscribe to my channel, or let me know what other content you would like me to create, and then I will see you guys next time. Bye!